long national lockdown are starting to sound strained. In a much-discussed article on Medium recently, two academics from Pittsburgh argued that lifting the lockdown at all, even many months from now, would be negligent. Quote, as long as a large majority of the population remains uninfected, lifting containment measures will lead to an epidemic almost as large as would happen without having mitigations in place at all. Well, that sounds plausible when you read it. In fact, it sounds like science. But is it science? A large majority of the population remains uninfected, they say. But is that true? We don't know it's true. As of today, nobody can say what percentage of the American population is infected or has been infected. There haven't been large-scale randomized tests conducted here. We don't even know when the disease first arrived in the United States. There's informed speculation that this strain of coronavirus has been here since late November or December. Authorities traced the first confirmed case to January 15th in Washington state. An unnamed 35-year-old Chinese immigrant landed in the United States after visiting his family in Wuhan and wound up in a hospital outside Seattle. Apparently, he recovered. Now, depending on how you count, the virus has been circulating among us for up to 4 months now. For most of that time, there was no systematic attempt to quarantine the population. How many Americans were infected over that period? Again, we don't even have a ballpark number for that, but the number could be enormous because the virus turns out to be much easier to transmit than we thought it was. On Friday, you may have noticed, the CDC issued new guidance on mask use. The government now recommends wearing, quote, cloth face coverings in public. Why'd they make that change? Because researchers are learning more about how this virus moves from person to person. Scientists now believe the coronavirus can be transmitted by someone who shows no symptoms merely by speaking. Remember when they told you that hand washing was the key to staying safe? That recommendation was based on the belief the virus lived mostly on surfaces, and that's not the case. We're still not exactly sure how the virus is spread, but among some populations, and this is interesting to know, it appears to be astonishingly widespread. An article in the Italian media last Thursday, for example, described a blood drive in a village in Lombardy. That's in the northern part, the most infected part of the country. Of the 60 people who showed up to give blood, 40 tested positive for coronavirus. None had shown symptoms of it. None knew they had it.
Unbelievable.
Keep in mind that Lombardy has been strictly locked down by government order since March 9th. That's almost a month ago. Yet about 70% of this group got it anyway. A report from Hong Kong in February suggested that a woman diagnosed with the coronavirus may have infected others 10 floors away in the same apartment building, even though she never came into contact with any of them. Health officials concluded the virus likely traveled through plumbing pipes to different apartments. And it wasn't a wild guess. In 2003, an outbreak of SARS spread the same way. So it's starting to look like the coronavirus is more transmissible than we expected or were told. The good news is it also seems far less lethal overall. People are still dying in large numbers. Not all of them are sick or old, and that's terrifying to watch. But as the data trickle in, there's evidence that many infected people are not sick. Iceland has tested a larger percentage of its population than any country in the world. They've tested about 5% of all citizens. The United States, by comparison, has tested 0.3%. So far, about half those who've tested positive in Iceland have been completely asymptomatic. So given all of this, what is a wise response to this pandemic? Historically, health officials have used quarantines to contain infectious diseases. Until now, a quarantine consisted of separating the sick from the general population and then doing everything possible to protect the especially vulnerable. In this case, that would include the elderly and immunosuppressed, among other groups. We have a pretty good idea that targeted quarantines work. They've been used for centuries around the world. But that's not what we did. Instead, the United States and many other countries instituted mass quarantines in which governments shut down entire nations for long periods. That's never happened before. Now, mass quarantine makes sense if you're fairly certain it will prevent mass infection. But are we certain of that? Well, despite what you might hear on television, we are not certain of that still. In fact, there are some indications it hasn't been as effective as we'd hoped it would be. Italy imposed one of the toughest lockdowns in Europe. Almost a month later, as we just told you, an overwhelming majority of at least one town has been infected with the virus anyway. Now, it's possible to imagine that a mass quarantine might stop transmission of a virus. It might work if it actually separated people, if citizens were forced to stay in their homes and not have any interaction with other people. But we're not doing that in the United States. We never will do that here. Too many Americans live alone, for one thing. People would starve to death. Instead, the directive we're living under is this: stay home except to buy food. The one place you can go is the supermarket, where, by the way, everyone else in your neighborhood has been this week. From an epidemiological standpoint, this is lunacy. If you wanted to infect an entire population, you'd encourage everyone in a specific zip code to meet regularly in one enclosed location. It doesn't make sense. Authorities must know it doesn't make sense, that's obvious, but instead of changing course or fine-tuning, they're doubling down, hoping that vehemence will compensate for bad science. Says the mayor of Los Angeles just last week.
That's stupid.
If you've observed recurring violations of the Safer at Home order, please continue to let us know at coronavirus.lacity.org/business violation. You know the old expression about snitches? Well, in this case, snitches get rewards. We want to thank you for turning folks in and making sure we are
Guy's a
all
joke.
safe.
We could turn off now.
Guy's a joke.
So you just saw the mayor of our second biggest city
You can turn
offering
off
to
now. That
pay
was pretty much
citizens to
what I
snitch on their neighbors for, among
The
other things,
supermarkets are a waste, Mom.
Supermarkets.
working
Everybody's
with
gonna get it in the
activities
supermarket.
should not be
Wow.
allowed.
Yeah, most
Job
of them
gain,
don't even
fishing,
know
golf,
that.
fine.
There
Being
you go.
employed, a massive threat to
If
public
it's
health.
that easy to get.
And let's
wow.
snitch on the neighbor, you know, for going out to a store that isn't a supermarket or a healthcare facility. Oh my gosh, what a joke. The hospitals and the supermarkets are screwed. Yeah, this is we're gonna keep watching, but this is just
Yes.
that's nuts. Good show.
I just wish we knew if that shit that we had back in January was that.
Is there a single person who
That weird
sincerely
shit
accepts
that
the
we had.
coronavirus?
Yeah, I totally can relate. Happy birthday, mommy.
Huh?
Happy
Thank
birthday.
you. Ah.
Happy birthday.
Mass unemployment is almost certain to cause far more harm, including